Brian Strackman, the Director of Product Marketing. And I'm gonna pass it on to Brian and let you take it from here.
Hey, thanks very much. So I'm Brian Strackman. I'm Director of Product Marketing at Mobileiron. So I handle a few different things, and one of them is I run the healthcare practice. So we've got an increased focus recently thinking about how our products can actually help those in healthcare. So today we'll be talking about healthcare mobility, securely improving efficiency in patient care. And of course, we're doing this via Zoom. So if you're like me, you are probably zoomed out. I am too. Yeah, I spend on the average, 5 to 8 hours a day on Zoom. My kids are now receiving education remotely via Zoom. So I really appreciate everyone taking the time to do this, particularly because the fact that it's difficult to pay attention to these sort of things over a long period of time. So I will do my best to entertain and inform you all at the same time and make the most of this platform. So let's get started here. Let's talk a bit about what's going on right now. Mobileiron just did a poll of 1,200 workers, and this is not just in the US, this is worldwide. So I know we're talking about healthcare, so this is more than just healthcare, but 80% of the employees around the world don't want to return to the office full time. Now, that's not really a surprise. I mean, actually, if you were to ask most employees, hey, do you want to go to work every day? The answer is going to be no, because you get to spend more time with your kids. You get to not have a commute. 72% of employees agree that their mobile device has been important during the lockdown. So what we're finding, though, is that more and more of the studies are saying, particularly in white collar environments, that efficiency is suffering. That, yeah, even though you're not commuting anymore, even though you might not have the distractions of the office, you're spending more time on meetings. I know personally that there are a lot of things where I could solve a problem with a 2-minute hallway conversation that I now have to schedule a 30-minute Zoom meeting to fix. So, the question is how long is this going to last? And the bigger issue now is because everyone is doing all these conversations remotely, security becomes an issue. 1/2 of the workers around the world consider IT security to be a low priority, which is a little concerning. Let's take it back to healthcare. That was normal knowledge workers. Healthcare workers can't stay home. They're in the front line. They have to go to work. They have to be in the office. And so they are stressed in ways that many of us who just work in normal office environments can't really understand. So what can we do to help this situation? Let's talk about what they're dealing with. There weren't enough healthcare workers before COVID. And I like these nursing stats because nurses probably have the largest mix of responsibilities. They're dealing with patients, they're dealing with doctors, a lot of times they're dealing with paperwork. So it's a good metric to see what happens across healthcare. And when we think about healthcare technology, I always like to use nurses as a proxy for those people that have the most mixed type of responsibility. There's 2.6 million nurses. This is in the US right now, but by 2022, there'll be a need for 1.1 million new nurses. And 690,000 of these jobs won't be filled. So we're already understaffed, and that problem is just going to get worse. And they're really busy. 61% of these nurses work in hospitals. They work 3 shifts per week. They walk a long time. So they're on the move. They're not sitting at a desk all day, which also goes to the issue of how to handle their mobility issues. They're seeing almost 7 patients per day. And a lot of Americans, 8.1 million Americans, are seen by nurses each day. And this is a pre-COVID metric. So I'm sure once we actually look at post-COVID numbers, that's going to go up. They just a metric of what they do. They transfuse over 80,000 units of blood each day. So these are busy, very important people. So the answer is, how can we help them? How can we empower people working in healthcare to be more efficient and make better use of their time? Because the problem of being understaffed is not going to go away. And we think the answer is mobility. So looking at what happens right now in the healthcare industry, healthcare workers already use mobile devices. 86% of clinicians already use a smartphone every day. 71% of millennials, those people that we love to hate, they'd like their provider to use a mobile app. 70% of patients would like their clinician to use a mobile app. 80% of physicians use a smartphone in professional capacities. That's a little bit different than using one in the clinic. That means that they're using it in some way for record keeping. And 90% of healthcare practitioners are using mobile devices to engage patients at point of care. That's from HIMSS, which obviously there's a spin in HIMSS towards use of mobile. So 40% of physicians use a digital device at point of care, mostly for medical records, and we'll talk about that in a second. And let's talk about preferences. 79% of physicians prefer iOS, so that's the Apple operating system, over other ones such as Windows or Android. And 63% of physicians are using their personal device. So that goes into the problem of BYOD, bring your own device, which is the bane of IT managers everywhere. And more of these records are being stored electronically. This is 2 years ago. 86% of physicians use electronic medical records. 28% of hospitals are scanning all their legacy records. So what we have is a situation where doctors using mobile devices. Let's go to a summary. Doctors are using mobile devices. Healthcare workers are using mobile devices. There is a staffing issue. More and more records are being stored electronically. And even patients would like to use mobile devices. Going into more of the demand side, 60% of people who are at home would monitor their condition online. 70% of people have looked for online health information, and we love those people, don't we? Those ones that self-diagnose. They come into the doctor's office saying that they have scurvy or rickets or something else they found online. I'm sure medical professionals love them, but this can be steered towards the right direction. If they look at their own medical records, 80% would like to see their own medical records online. And 90% would use a service allowing people to ask a doctor online. But the thing is that very few people do this. Only 20% have ever done so. So there is an opportunity here to capitalize on this if we steer the use in the right direction. And we look at how they're using their devices at home. 51% of people use their devices to track their workouts. 27% of people have used their care provider's website. So we can push that up a little more. 26% use their care provider's website to book an appointment. So we can make things more efficient if we utilize this correctly. So that's, patient demand already exists. So there is a need for this. But how do we balance this with security? Because as we talked about, the more records are online, the more people are using mobile devices, both from the supply side, the provider side, and the demand side, security becomes an issue. So this is a stat we got from our partner. We work very closely with Verizon, who's a provider for a lot of these sort of things on the network side. And what we found is that there have been compromises made in security. 37% of healthcare companies have sacrificed security in some way. 38% have suffered some sort of security compromise, be it a man-in-the-middle attack, some sort of, the common problem now is blackmail, where there's some sort of lockout, and then there's a ransom to get access to your data again. So this is a problem that's becoming worse and worse. And we've asked healthcare IT professionals, what are your concerns? The biggest one is protecting data, protecting health information and data. But then we go into it, securing devices. And as more and more patients, doctors, nurses, techs use devices, that becomes an increased concern. We want to cut down on fraudulent activity. So that's putting these devices in the right network, stopping ransomware and malware, and then also compliance. So those are things like HIPAA. And then lastly, which I think we should probably focus more on, is end user education and awareness. So this is where we have a little bit of an advertisement, but you have to expect that. We're going to talk a bit about what Mobileiron does. And we parse what we do into 3 areas. We manage, protect, and empower. Manage, that's UEM, that's actually where we manage the devices. Protect, that's MTD, so we actually provide security. And empower, so that's providing access, and we do that through ZSO. So that's actually being able to provide passwordless access by having your device scan your face. So the best way for me to articulate this is to actually go through this step by step and show you how this works for a given healthcare worker step by step. So we're going to go through the day in the life of the healthcare worker. And generally, we have a picture of a nurse because, I said, they have the most mixed set of responsibilities. But having said that, there's a lot of different ways here to look at this. So, and we'll run through a quick demo for each one of these. So let's start here. So the nurse checks in, and she grabs a device. He or she grabs a device from a pool of shared devices. They log in, and a lot of times we can use our ZSO. So they scan your face, and they get automatically set up on the device with their data from a pool of shared devices. And this is usually from a device such as Honeywell or Zebra, that makes these sort of things. So we're seeing a nurse check in from a shared pool of devices. And the benefit of this is all these things are automatically provisioned while they're not being used. We can push out the apps automatically. So what happens is that the nurses and the healthcare workers will get a device with the apps they need specific to their profile. All right, so the first patient arrives. Okay, well, how do we work this? Theoretically, if you're using a mobile device, you should be able to get the patient's electronic medical record directly on your device. And here we're showing what would happen using Epic Haiku. So if you're using Epic electronic medical records, you get access to this in a safe, secure, HIPAA-compliant fashion by having the device use ZISO, which scans your face. And now, very quickly in the palm of your hand, the medical professional can see the data of the patient right in front of them. And we can see that this really makes things more efficient. It's convenient, it's easy to use, and also it's very, very secure. Another use case is a clinical study, and we're hearing more and more about this because I'm sure a lot of different hospitals are involved in COVID studies, but this happens all the time. So by way of example, here's a 23andMe study taking place at Stanford, and this sort of app can be deployed to mobile devices so it can be used and the study can be run in a more efficient fashion. Now, here's a big one, IT assistants. And I talked a bit about this earlier, in that most of these medical professionals are on the move. You're running around, I think nurses walk an average of 4 miles per day. They can't stop doing what they're doing to go and get IT assistance. So the solution here is to make IT assistance available with our product called Help at Work, which means that if there's an issue, you trigger Help at Work, the IT manager can walk through all of this remotely. So they take control of the device, fix the issue, and the worker doesn't have to stop what they're doing, go to the IT room, have someone physically touch the device. It can all be done remotely. So this makes things more efficient. It's much more easy. And also it makes it more likely that the right kind of software stays deployed, because periodically when IT looks at this, they can make sure everything's being done correctly. Team collaboration. So this is the big one, in that in a situation where, say, a physician or a nurse wants a consult, a lot of times Zoom, which we all love Zoom. I'm going to get off my Zoom soapbox, or Spoke Mobile, if they need to get a consult, a nurse or a tech needs to ask a doctor very quickly on how something works, they can use this for a collaborative effort. Standard day-to-day issues like a vacation request, they shouldn't have to sit down to ask for a vacation request. Things like scheduling, this can all be done remotely. And usually, a piece of software like ServiceNow, I think that's what we're showing right here. This is where they're going through, managing their timesheets in real time, requesting vacation, all on the fly. So possibly while they're waiting for a patient's blood pressure to be taken, they can do a vacation request. So this goes back to the efficiency message. And a big one is security. So within all of this, MTD, Mobile Threat Defense, this is our security. So this stops any sort of issues that may compromise security. So things like phishing, man in the middle, you can also have things like controlling which network it talks to. All of these security issues, particularly when you're dealing with things like patient data, which must be HIPAA compliant. Someone's stealing this data, it could be a real problem. So making sure that you have MTD in every device, and that the device is constantly scanned to make sure it's secure. And when there is a security issue, I think you just saw there in the demo that, hey, this device had a security issue, we're actually quarantining the device, it's shut down until someone can take a look at it, fix it. So before anything gets stolen, any ransomware takes place, anything gets worse, the device can automatically be quarantined, fixed, and then redeployed. So end of the day, we have the end of the day worker. So this is a shift worker, so a tech, a pharmacist, possibly a nurse. They go in, they log out, they put the device back into the cradle with all the other shared devices. At this time, the IT managers can go in, schedule maintenance, they can update the firmware, put in new software, all done seamlessly while the device is just waiting to be used by the next worker. So a good question is, all right, there's a lot of different use cases here that we talked about. We went through, talked about the day in the life. There's different devices to look at, different software to deploy. What's the best way to get started with this? And I like this quote, the journey of 1,000 miles begins with a single step. So how do we suggest you get started? Here's what we suggest. we look at the healthcare world by use case, and we've bucketized use cases into 3 different buckets. So the first one is streamlining onboarding, securing, and management of assets. And you can see 3 use cases there. Doctor BYOD, managed desktop and consulting physicians. The other bucket is optimizing patient care, improving collaboration and workflow. So that's clinical comms, virtual rounding, and telemedicine. And the last one is patient satisfaction and engagement. So those are things like bedside solution, patient check-in and out, and drug delivery. What we would suggest is, as a proof of concept, pick one of these that we view to be the biggest problem. Which one of these use cases do you think is one you want to tackle first? See if you can fix these one at a time. And by way of example, here's nurse to pharmacy communications. And we've heard by a lot of our customers and by the analysts, experts, and consultants that this is a big one, that the nurse communicating with the pharmacy back and forth is a big hurdle, is a big problem and a time suck. So what we've done is we go in and we've actually parsed this problem step by step, showing how it is done right now and how we can actually make it more efficient and automated using our solution. And I'm not going to go into each detail here, but what we've done is for each one of these use cases, we can crack it, dive into it, and fix it one by one. So, for example, this is how nurse to pharmacy comms can be made more efficient, remain HIPAA compliant, and make everyone's life much easier. That's it. I think I promised everybody that I'd do this pretty fast. So I'm going to stop now, open it up for questions. And
great. Thanks, Brian. I do want to let you know, I want to point your attention. We do have a question in the Zoom chat. We also have a question over in the event portal. So to anyone who does have a question for Brian, please direct them there.
You know what? I can't see the portal, so if you wouldn't mind.
Oh, sure. Does the mobile threat defense protect against phishing? And if yes, how?
Yes, it does. It does stop phishing. And actually, if that sort of thing happens, it will automatically quarantine it. It knows if phishing is taking place. We actually use MTD from Zimperium. So it's actually a very robust solution. So answer is yes.
And do you want me to read off the Zoom question?
Yeah, if you wouldn't mind, please.
Sure. About filtering phishing emails. If so, how are you doing that? Are you using a third-party solution to control phishing emails?
The answer is yes. That's a Zimperium solution for MTD. So phishing emails, we do scan for those. So it will quarantine them, and if it's bad enough, it'll actually quarantine the entire device. I think there was another one that I saw. One of the ones was, are you HIPAA compliant? The answer is yes, we are. We are HIPAA compliant. We actually have a document on our website. We have a white paper that goes through our HIPAA compliance, because that's a long, complicated answer, but yes, we are HIPAA compliant. Let's see, another one that I saw here was, how do you recommend you get started? That's kind of what I was going into, is that I recommend that you pick a use case that is your biggest problem. Do these one by one. So I put a list of use cases up there, and I would suggest that you like nurse to pharmacy comms, if that's what you want to crack first, use that as a proof of concept. Fix that issue. If it works, then work on other use cases step by step. I think another one that I saw is, does device type matter? And so we do support multiple devices. So we support iOS, Android. We can actually manage the entire desktop solution, so both Windows and Mac OS. And then as far as actual devices, because I know a lot of rugged devices exist in the healthcare environment. So what you see are a lot of devices made by manufacturers like Zebra and Honeywell. We support those. We have tight relationships with those manufacturers as well as a few others. So we actually have integrations with those already ready. I don't see any others.
Brian, we do have one other one that came in. Does the MTD solution require end user download and activation?
Not a manual process. It's actually pushed out automatically. So part of our UEM solution automatically deploys that. So it's not something that the user has to concern themselves with. So I know that's a big issue. That's actually true with all the software, that any of the apps are automatically deployed rather than having to have the user manually do something.
Great. And then in terms of BYOD, how do you handle that?
We do support BYOD, and I know that particularly in healthcare environments, it's a big deal because physicians like to bring in their own device. We absolutely support BYOD. We know that physicians tend to like iOS devices. They want to bring in their iPhone, and what we do is we containerize their data. So a physician or anybody else's personal data is in one section, and then there's a wall between that and the work data. So what we do is all their work data, their work applications are in one section, their personal data is in another, and we can support that and actually manage their device in a partitioned manner. That's one of the use cases that we already have mapped out, and is a very common one, like I said, particularly in healthcare, where a lot of physicians like to bring in their iPhone from home.
And Brian, are there remote wipe capabilities when they leave?
Yes, so that's actually something that our UEM does. So from cradle to grave, initially if somebody leaves, we'll wipe all the data so that there is no danger of any sort of proprietary or secure work data leaving when somebody takes their work device home. Absolutely. See, I'm not seeing anything else.
Thank you all for these questions. These are great. Thank you for making it interactive. Brian, any other final thoughts?
No, I just wanted to thank everyone for attending. As I said, I know that sitting through a lot of these Zoom meetings can be very challenging. As I said, that I've got Zoom fatigue. I know my kids do. So thanks for doing this. Feel free to contact me directly. My work email is right there, as well as my LinkedIn information if you want to reach out to me. Other than that, I really appreciate everyone joining today, and I'll just say thanks very much and enjoy the rest of the seminar.
Brian, thank you so much. That was a great conversation. To everyone here, as Brian mentioned, you can email him directly. You can message him over in the event portal. You can reach out to me for contact information. We'll be happy to get you all connected. So Brian, thank you again. And to everyone else, we will see you in the next session. Thanks so much.
Thank you.